The MSL Society recently conducted a global survey in order to gain insights into the utilization of social media by MSL teams and medical affairs teams as a tool to track the activity of KOLs using social media. We've had over 650 MSLs and MSL managers, directors, VPs from 47 countries that have registered for today's webinar. Joining me to discuss social listening of KOLs as a tool for medical affairs is Luca Dezzani, who is the VP and head of U.S. Oncology Medical Affairs at AZI, and Bruno LARVOL, who is the CEO and founder of LARVOL. What is social listening and how is it conducted?
I think social listening is really the art of monitoring social media to generate insights that are valuable and actionable to the organization. I think the world is changing. Clearly, the way we engage with thought leaders is also changing, and getting visibility into what they are sharing on their social media channels is extremely insightful and valuable.
You could see at some of the recent conferences, a great example is ESMO in cancer. How much and how quickly did the narrative, the conversation about new data took place in social media, and how much the biggest voice, the influencers, the KOLs, which probably should be called digital opinion leaders now, how much their reputation, their influence, and their voice is in social media.
The data slides we're going to be discussing are the results of an online survey that we just conducted September 20th through the 8th of October. And we had a total of 513 MSLs and managers from 42 countries.
I think it's fair to say that because of the pandemic, we have seen a decrease in the number of interactions. I think number of interactions doesn't really tell the whole story. What we have been observing is actually a dramatic shift and significant improvement in actually what is the quality of the interactions, meaning that maybe instead of a 30 minutes chat with a key opinion leader at the conference with all the distractions that come with it, you have a very focused 45 to 60 minutes Zoom or whatever your platform is interaction with a key opinion leader who really has undivided attention for you and your content.
I think it's actually remarkable that despite all of this, 40% nearly of people said it stayed the same or it increased. And I think it goes to the point that Luca mentioned, which is that the nature of the interaction has changed. How do we adapt the way we engage to the new situation? If we add value, whether it's by Zoom or in person or in virtual reality one day, if we add value to the KOLs, we've done our job.
I really envision medical affairs and the role of the MSL really to evolve and to really be different in the future. So maybe this 10% of people who saw an increase are really those who are already ahead of the game and are already able to combine and bring together the best of both worlds, right? The traditional way that we are all very comfortable with of engaging with thought leaders in person, combined with the new way, the fastest way, the more convenient way, which is to jump on a Zoom video conference in a matter of a couple of hours.
What we're seeing that there is a percentage of MSLs that are actually not only increasing their level of engagement, but a large percentage, and we saw this in a couple of surveys, their productivity is going up because it does make them and forces them to be efficient. But I think it's the certainly the efficiency that you've alluded to, Luca, in that I don't have to get on a plane anymore and fly 3 states away, right? So if a KOL wants to do a quick engagement and go over a paper, or I don't know, latest clinical trial results, that's much quicker and easier to schedule.
Quality of the relationship based on the value that has been created. So how do you measure a relationship? Ultimately, the key is how strong is a relationship that has been built with a KOL.
If you're in a situation where you are in an environment where you're going to have decreased level of engagement, again, social listening may be another tool that you use to maximize those engagements when you do have it.
We are investing more and more into social media listening and leveraging social media to engage with thought leaders. I'm 100% certain that most MSLs actually use a combination of 2, 3, 4, maybe all of the different sources that you listed here. I think I would have expected social media to really rank a bit higher here, especially during the pandemic. And the main reason for that is that these are very unusual circumstances, right? So these are very different times. I think by looking at social media, we can definitely get a very clear picture of how engaged, how active, and to a certain extent also how technology savvy thought leader may be.
We have, I think, that burden to understand these incredible new ways influence is built in social media. And so I think it's a super good time to get invested in understanding social media. Investing in social media at the personal level for fun is a great way to understand how that tool is going to be increasingly useful professionally, including in understanding and listening to the conversation with KOLs.
All the big conferences are not happening live, meaning in person anymore, right? So most of the Q&A, discussion, debate that was happening at the end of the sessions or after the sessions in the hallways, it's now actually happening on Twitter, right? So unless you are on Twitter, unless you are active on social media as a medical affairs professional, as an MSL, you are going to miss a lot of insights, right? You're going to miss a lot of that debate, a lot of that discussion, a lot of those perspectives that it will become even more a must for medical affairs professionals to be active on social media. There is no mention of tools that are now extremely powerful, right? So we have a number of tools that leverage artificial intelligence, actually LARVOL obviously being, LARVOL Omni being one of them, that actually make our life so much easier, right? And even if we are not social media experts, or even if we don't have time to go into 4, 5, 6 different websites or data sources, there are actually tools that aggregate all these different sources of information, including social media, and are extremely easy to use. And it's becoming more and more clear to me that we do have thought leaders, or now we call them digital opinion leaders, who are extremely influential on social media.
For me, 80% of the activity is on Twitter. And what I noticed on Twitter in oncology is that the Twitter community of oncologists is wary about the influence of pharma. And the house, at least in oncology, for example, Onco Alert is a wonderful community. It's a community of oncologists, and we industry people are welcome to stop by, to say hello, to like and retweet. But in my opinion, we have to make sure that it stays their house. So there is a little bit of cultural community etiquette and sensitivity that we have to continue to understand as industry people.
They may not be on social media themselves, but obviously, as I was referring to earlier, we do have tools and we do have platforms that we use for social media listening. So you don't have to be, even though I think it's, to Bruno's point, it's becoming more and more important. You don't have to be personally on Twitter or active on Twitter. There are ways and tools that make our life easier and allow us to do social media listening without being on Twitter ourselves.
If you're an MSL, you have to be on Twitter, and you have to be on LinkedIn, and you have to follow your KOLs, because otherwise you don't have a direct. You're not in the flow of information.
What are some of these examples of some of the social media tools for listening? Can you share just a few of them?
LARVOL is definitely one of them, a very powerful tool because, again, it really combines social media listening with other channels, right? It's a nice aggregator of information that you can find not only on Twitter, but also on clinicaltrials.gov and many other platforms. I really think it's important that you identify what is your need. If your need is only to track social media, then you can go for one of those platforms that pretty much do that only. However, if you want to have a more, let's say, broader approach and track your thought leaders, not only for their social media or for their Twitter feed, but beyond that on multiple different channels, then a tool like LARVOL may actually be a better option. Even just by sharing, as an MSL, sharing articles, obviously not things on particular brands, right? Treatment landscape, disease state, but just by sharing articles, sharing knowledge, building thought leadership, right? It really shows that you care, right? It shows that you are engaged. It shows that you care about oncology or neurology or whatever, the disease state we are working in is. And it shows that you are on top of the latest breakthrough in your space.
I did want to at least say thanks again for LARVOL for sponsoring this and being a part of this. I want to say again, thanks to Luca and Bruno for the awesome insights and perspective today. Thank you. Reach out if we can help. Bruno, Luca, thank you very much.
Thank you.
Thank you.